Once again, welcome to the folks who are just joining us. Feel free to introduce yourself in the chat, and we will get going in just a minute. That's so strange. 1 second, folks. And thank you. I see people are dropping things in the chat. Welcome, everyone. Thank you so much for taking the time to be with us here today. Not sure what's going on with my screen. Apologies. Give me 1 more second. Here we go. So yes, welcome everyone. Thank you so much for joining us here today. My name is Aurora Grant Wingate, and I work for the National Association of Community Health Workers as their member and partner engagement associate. And I bring you greetings from Boston, Massachusetts. And for folks just joining us, please feel free to introduce yourself in the chat. This is going to be pretty interactive. We intend to have a pretty long Q&A period at the end. If you have questions as we go along, please feel free to throw them in the chat. We will be recording this so folks can watch it later on. If you don't want to be recorded, please feel free to stop your video. And yes, we have a great presentation today talking about the American Diabetes Association's focus on diabetes, as well as talking about how NACHW fits into that partnership. Before we get started, we'd like to, if anyone's new to NACHW, to sort of formally introduce ourselves. We are a membership organization with a common vision to see community health workers united nationally to support communities in achieving health, equity, and social justice. We use the term community health worker as an umbrella term for the many different job titles that community health workers might hold, such as promotora de salud, peer outreach worker, peer support specialist, community health representative, and so much more. Once again, we're a membership organization, and we have 5 strategic values that we use to advance CHW professional identity, like engaging CHWs, allies, and supporters and others, expanding our membership opportunities for collective action, enhancing CHW leadership opportunities, educating key stakeholders on the impact of CHWs, and establishing a national voice on many different issues that are important to the CHW profession. We now have members in all 50 states. We're very excited to say we now have a little over 2,000 members across the country, as well as some in some of the US territories. The states you see here in green are where we have the most membership. And there are many other things that you can check out on our website as we're all getting settled here today. We have a registry, we have, a directory, we have a document resource center, a policy platform, COVID-19 resources. All of this can be accessed at our website at NACHW.org. Just a few more announcements before we get started for the sort of meat of our presentation today is right now we are ramping up for our annual Unity Conference this summer, which will be August 3rd and 4th. This is our 3rd virtual conference that we are doing. Last year we had over 800 registrants, over 70 speakers, all of which we expect to do bigger and better this year. Right now, we have a call for presentations out, a call for sponsors, and you can check that all out at nachwaunity.org. We look forward to seeing many of you there, as well as we are hoping to do a roundtable alongside the American Diabetes Association on CHWs and diabetes. I also want to lift up another opportunity, which are our learning collaboratives. We have one coming up in June 30th. This is a place for CHWs with different experiences or expertise to come together to discuss different topics. This is an open meeting for our members, and we look forward to seeing many of you there. So now to sort of get into some of our meat of our presentation, again, I want to thank you all for being here today, and I want to thank Laura Hiramos from the American Diabetes Association for coming and offering to speak about Focus on Diabetes and Healthy Vision Month. Laura holds a doctorate in nursing practice and is a master licensed diabetes educator, board certified advanced diabetes manager, and certified diabetes care and education specialist with over 30 years experience in diabetes care and education. She is the vice president of healthcare programs at the American Diabetes Association, and she is an adjunct associate professor at the College of Nursing at the University of Kentucky in Lexington. I will hand it over to you, Laura. Thank you so much for being with us today.
Thank you, Aurora. It's a pleasure to be here. I've seen the chat and seen a number of different people from all over the United States, as well as even some CHWs in training. So that is exciting to me that we've got a lot of experience, a lot of individuals that want to learn more and become the awesome community health workers that you are. So without further ado, I'm going to share my slides. Share my screen first. All right, and then let's go for slideshow. Maybe. Have to move it when it's covered up. Okay, can you all see my slides, the actual slide presentation? Are you seeing the slide covering the whole screen?
We're also seeing the notes right now.
Okay, so let's go back. Go to screen 2. How about now? Did that help? Full slides? Thumbs up? We're good. All righty. Well, let's go ahead and get started. So today I'm going to talk about eye health. This is Healthy Vision Month. Vision is extremely important to all of us. It's like the window to the world. I think it's been described. And it is something that really allows us to perceive our environment in a number of different ways. But in particular, I like this time of year, and in Kentucky, there's lots of blooms, lots of pollen that go along with that, but lots of beautiful blooms. And when you walk outside, it's breathtaking. And so I'm sure a number of you have your own beautiful environments that it's a pleasure to see. So this topic is that the ADA calls therapeutic inertia. And it's important for us to understand that. What that means, inertia, means is that you're in kind of a steady, stagnant state. And in diabetes, that's not a good thing. It's not a good thing because what happens is individuals with diabetes have a progressive disease. And every year that goes by, which is welcome to add the years, every year that goes by, it's welcome, but every year that goes by, it's progressive and things change. And so you constantly need to be working with your healthcare professionals to make sure that you maintain your healthy you and that an individual is receiving all of the standards of care, medical standards of care, and the standards of quality education so that they, again, know how to best take care of themselves. What's interesting to note is the statistic on this screen that about 50% of people with diabetes still do not get an annual dilated eye exam, or at times are diagnosed too late for effective diabetes treatment. In other words, they may have had a hidden diabetes or not recognized it for a number of years. You can't start at the beginning of treatment at that point. The treatment has to be started where that person is, that you can predict their state of diabetes. So on the next slide, I'll do this before I move forward. I know this is an important part, is I'm just going to disclose that I have no conflicts of interest or no disclosures. So our mission with Focus on Diabetes is really focuses and mirrors the American Diabetes Association's mission, which is to prevent and cure diabetes and to improve the lives of all people affected by diabetes. And when we say people affected by diabetes, it's those individuals with the actual diagnoses, but it's also all of those individuals that take care of, that interact with, that work with, all of the individuals that are affected by the disease state. And what we know is a little over 37 million Americans have diabetes. 88 million have prediabetes. So that's prediabetes is really a prediction of potentially developing diabetes. It comes sort of in between not having diabetes and having diabetes, prediabetes. And so we've talked about therapeutic inertia, but it is a problem, and we recognize that. And so the American Diabetes Association is doing everything we can to try to push that steady state, to try to push individuals in the healthcare arena, individuals who have diabetes and family members to understand that we've got to move forward and be progressive with treatment so that we can prevent the complications of diabetes. And so really treating the patient, the whole patient, is the solution. And we'll talk about that in a few minutes. The right patient, the right treatment at the right time. That should be bolded, because the treatment needs to be when it's most effective and when it's best going to help that individual with diabetes. So treating the whole patient, you can see diabetes in the center there, and you can see a number of different really comorbids that occur with individuals with diabetes. And it being Healthy Vision Month, we're going to focus today on the eye and a closer look at eye health. So what this initiative does, we have partners that we'll talk about in a few minutes. It really brings together leading consumer-focused industry and service organizations to increase the awareness of and reduce diabetes-related eye disease. We consider you a valued partner to be able to help us extend our reach in order to promote healthy vision. So why focus on diabetes? Well, it's important to us. It's right in the middle of our name, right? The American Diabetes Association. But diabetes and blindness is important in terms of vision because it's the leading cause of blindness. Diabetes is the leading cause of blindness in adults of working age. It's predicted to increase to almost double in what? Less than 10 years. At-risk populations are African Americans, American Indians, and Alaska Natives, Hispanic Latinos, and older adults, older meaning 60 or older in this case, are at higher risk of losing their vision related to diabetes. And when you lose your vision, that word blindness is pretty stark, but when you lose your vision, again, you lose that window to the world. You can see the annual or the yearly economic burden there is in the billions. And you can see then the growth of diabetes-related eye disease in individuals with diabetes. So this is key, very important. So I want to focus for a few minutes here. First off, consumer awareness and activation. There are a number of people out there, as we talked about, millions, who have prediabetes. And only about 2 out of 10 know that they have prediabetes. So we've got to start way earlier in identifying the prediabetes state. And we've also got to understand that even individuals with type 2 diabetes in particular don't know they have it about a third of the time. So this can't be happening. Not here, not in our areas, not in our states, not in our country. This cannot be happening. We have to make a change. People with diabetes support and their education. We have to teach people the importance of paying attention to their eyes. One of the things that's important to help people understand is they're not going to feel symptoms of eye disease in general until it's more severe. So by doing those protective examinations, the preventive examinations, and getting treatment early on to halt or prevent blindness is key and very important. And then we have to educate our peers, our primary care providers, all healthcare professionals. We have to be intelligent to be able to understand, deliver, and then emphasize the importance of awareness in diabetes, and particularly the prevention of blindness can be done. So these are our key messages. So if an individual is at risk for diabetes, talk to their healthcare team. We have a diabetes risk test that you can go online and you can see what your risk is for diabetes. And it will ask you a number of questions, assign points to the answers. And the more points that you get, the more likely it is that you have type 2 diabetes. And sometimes people will say, well, I'm right under. I'm 1 point under developing type 2 diabetes. That means I'm not going to get it. Well, let's say that person's 50, 58 years old. All right. When that person gets to be 65, Lord willing, they get to be 65. When they get to be 65, their points go up no matter what else is happening in their life. So if they're 1 point below the mark, knowing that they can get to that high risk state later, that's something important for them to be aware of at 50 years old, 58 years old, so that they can try to change some of the risk factors that are modifiable. So very important. For adults living with diabetes, an annual eye exam is a must. Okay, it's a simple way to prevent or delay disease and vision loss caused by diabetes. I often tell patients, because I come from an educator background, as you saw earlier, I often tell people, you want to go to the eye doctor, you want to get a good report, right? You don't want to get bad news. So just because you got a good report doesn't mean you don't go back next year. It's important you get that good report and you keep that good report. So important to really emphasize that to individuals. The annual comprehensive exam is very important to detection, intervention, prevention, and really being able to treat eye disease earlier should it occur. Blurry vision is a symptom that we often hear from individuals with diabetes. Sometimes individuals have blurry vision before they're even diagnosed. It's something that needs to be checked out. Blurry vision can come from random, if you will, a day of high blood glucose levels or hyperglycemia. And a lot of times individuals will complain of blurry vision if they've had a day or two where their glucoses have run higher than usual. If they get the blood glucose levels back down, then the blurry vision will usually subside. But the importance is if it does not, then they need to be recommended to have their eyes checked out. So that's extremely important, is knowing what blurry vision means, and if it doesn't subside, to be able to seek help for that. So these are some surveys that we've done. And the first one was between October of 2020 and December of 2021, just a little better than a year. And we had over 3,000 respondents who scored high risk on the diabetes risk test. We offer this test online, so we can monitor, the answers, not names necessarily, but just the answers and the follow-up with that. Out of 59% who talked to their healthcare professional about the risk results, what they saw, 38% were tested and diagnosed with prediabetes, and 40% were tested and diagnosed with diabetes. Now, that sounds kind of frightening, but it's actually a good thing, because if they'd not taken that risk test, who knows when they might have been diagnosed with those particular disease states. Out of the 59% that talked to their healthcare team about their risk for diabetes, 18% talked to their eye doctor. So actually an eye doctor about their high risk score. 298 respondents replied to the question about being diagnosed with any type of diabetes related eye disease. So it could be less severe to more severe, but 298, that's almost 300 people that were followed and had some sort of eye disease diagnosis. So these things are important. Data are important. The Living with Type 2 Diabetes survey, we had about 200 response, just a little under 200 responses. And you can see the results there in terms of improvement in eye exam. So just by testing, just by telling, these individuals went on to get help earlier than they potentially would have if they'd not done these particular surveys. So we do have a number of Ask the Expert events. There's two real points I wanted to make with these. These are our 2021. They're in gray because they've already happened live, if you will, but they're also recorded and they're available on our website, which I'll share with you in just a few minutes. These are the 2022 events. We've done 2 of those. One's coming up later this month. And the ones that are in black, you can go to our website and you can find the date and the time for those particular Ask the Experts. The Ask the Experts will include eye doctors, may include diabetes educators, which are now called diabetes care and education specialists, other providers, sometimes endocrinologists. So you get questions asked when individuals go to this site. So you can refer your patients to this site, or you can attend yourself if you're interested. So we talked a little bit about blurry vision, and in late last year, we launched a blurry vision or blurred vision campaign, and it ran for about 3 months. And I won't read the numbers to you, but you can see a large number of individuals that engaged in some manner learning more about blurred vision. So that social media works. Shall we take a show of hands on anyone who's ever engaged with social media, excuse me. Yeah. So it's here. It's here, and it's a method of communication, and in some sense, it works. Also, Healthy Vision Month. In 2021, we wanted to share this with you. We've just started our campaign for 2022. But you see a number of different things that we've done, and really our messages are to educate, to empower individuals to take charge of their diabetes as a whole, but in this case, in particular, their eye health with respect to diabetes, to execute programs, information sharing, and encourage individuals as well. Randy Jackson, as you know, I won't, share with you his CV. You can see a number of things there, but he's been an eye health champion that's partnered with the American Diabetes Association. And one of the things that Randy's been really good at is he is really good at talking about how he just totally ignored the signs, the symptoms, the really knowledge that he probably had diabetes, probably. And Randy has done a good 365-degree turnaround to really take charge of his health, take charge of his diabetes, and really push the message and encourage individuals to take care of themselves. The other thing I liked, and this is a little story I'll share on one piece of social media I saw. He is an advocate of airplane meals. Yes, I said airplane meals. And he said that when you get a meal on the airplane, and we all know how small the table is to begin with, right? When you get a meal on an airplane, it's the perfect serving size. The small piece of meat, let's say, the sides. Usually it's on a little plate that has its portions delivered, and usually it's not piled very high, right? So he's a strong advocate of airplane meals, and it's because he feels that they're portioned very appropriately. So I kind of like that. I think that's good. You'll also see a number of different individuals, which we're all on the screen these days, utilizing our Zoom platforms and our Teams platforms and all of the platforms that we can use to meet and talk to each other from the convenience of our own chair. You'll see our Ask the Expert roundtable discussions, different things that we've been doing to educate populations. And here you see one of the individuals is an ophthalmologist, another's an optometrist, one is a person with diabetes who is blind in one eye, sharing the story about that. And the gentleman in the lower left is Dr. Bob, Ask Dr. Bob. And Dr. Bob talks on a number of different topics around diabetes, and he's our chief medical officer. He's my boss. So he is just really engaging and really funny at times, and he talks again about everything, including eye health. The names that you see there are the people that are in the background or behind the scenes for us, and those are our ADA communications and marketing individuals that really help us pull these things off. And so you can see some other different initiatives really helping people with diabetes in general, but all of this together helps that individual take total care, total health with their diabetes. American Diabetes Month, which we like to call ADM, we have a lot of acronyms. We like to call it ADM, and we've done a number of different media campaigns, including managing diabetes and eye health during COVID. We all know about COVID, and then we probably don't even want to talk about COVID, really. It really took 2 years out of our lives, so to speak. It made our lives quite different. And what we learned was, in terms of eye health, it was one of the things that people gave up. When they were trying to take care of themselves, it really fell to the bottom of the list. And so it's important that we understand this, because we've really got to get those people back in, like now, in order to get those individuals seen and see how the last 2 years has potentially affected their eyes. I know when you go to the eye doctor, and you can think about it in terms of either pictures you've seen, if you've been there yourself. I mean, your face is quite close to, you know, the ophthalmologist or optometrist that you're seeing. And so it's important that we remind ourselves that these things are really important, and what things we need to do, such as wearing masks, providing additional barriers, but utilizing the resources we have to promote eye health. These are our strategic alliances, and I'm just about to wrap up. The National Medical Association, really trying to identify those high-risk populations, you know, emphasize that individuals with diabetes and their eyes need to be taken care of just like the rest of their body. Very important to have it, the annual eye exams, or based on the clinical judgment of the particular provider and the health of the individual with diabetes eyes. Very important to align with our National Medical Association. And we can all align as healthcare professionals, healthcare providers, health information providers to do that. We're going to take a quick look at the retinal risk in just a few minutes. But before I do that, I just wanted to wrap up so that you would have our website. And I'll be sending out a 2-page overview piece. I'll send that to Aurora either this afternoon or early tomorrow, that she can push out to the group that attended today. Our visionary partners are industry. We talked about that, and that's our partnership with industry to help us with funding to be able to develop programs and align with different speakers and talk to healthcare professionals and our partners, such as this great group that are here today. So I'm going to go backwards. And what we're going to do is I am going to click on the retinal risk test. It's a very quick test. And the reason I did it this way is because it's going to come up on my other screen. Hang on, let me share again. Okay, so again, you can share this with your patients. So let's start, and we're going to do a imaginary patient. So, and we're going to say we're over at 16, not much, right? But a little over 16. Continue. We're going to go in English since I'm manning the answers here. So let's say we have type 2 diabetes, okay? And let's say we've had it for 5 years. That's at least how long we've known it. And we'll say there's mostly, all I can see in my view are females, excuse me to the males, but I can see females. So I'll put female. And so we said 5 years ago, so 2017. And we're going to say, no, we don't have diabetic retinopathy. We're going to say our A1C is, let's say we'll say it's 8. If I can get it to 8. How about 7.5? All right, we're going to say that our systolic blood pressure is running about 140 to 149. And that will come up because we know it's too high. So there'll be a message there since this is web-based. And we'll say, we think our blood pressure is pretty good. So we'll say it's 80 to 89, which is still too high. Okay. So what this does is it shows us that we have a medium risk of retinopathy. You know, so somebody looks at this and go, I've only had diabetes for 5 years. But the person has hypertension. They have a blood pressure that's maybe their average blood pressure is not necessarily optimal. And the same thing with their A1C. And depending on what medications they're on for their type 2 diabetes and that. So they have stage 2 hypertension based on that average of that number. Okay. So it says their A1C slightly elevated, but they've still got a medium risk. Okay. And then the person can actually have the risk sent to them and they can take it with them to their provider. All right. And then here is just, they can take control of their eye health. And then they can go and it'll tell them the importance of the annual eye exam and so forth. So use this tool. It's free. It's on our website. And as I mentioned before, I showed you guys the website earlier just because I knew it would take us to a different screen. So with that said, I think we're going to take Q&A just a little bit later. If there's a question in the chat while we're working on the next discussion, I'll be happy to answer it, but I think we're going to take Q&A. So thank you all very much. It's been a pleasure to be here today.
Thank you, Laura. That was fantastic. But folks might be wondering a little bit about how does sort of NACHW and community health workers fit into that. And that's a little bit what I want to share with folks right now. Laura, if you want to let me share my screen for a moment.
Okay.
Thank you. So a couple months ago, the American Diabetes Association reached out to NACHW. We had done a little bit of work with them last year around No Diabetes by Heart, and they said, well, we have this great new initiative that we are undertaking that we would really love to get out to community health workers. We know that community health workers, many specialize in diabetes, but diabetes is something that is also touching so many of the different communities community health workers might be working with, whether you're working in maternal and child health, whether you're working on men's health, whether you're working on returning citizens. Diabetes is going to affect basically all communities, and we want to make sure that all community health workers have some basic knowledge about diabetes and the related diabetes-related eye disease. So they have partnered with us to first and foremost lift up all the great resources that Laura mentioned, like their Ask the Experts and all the different resources that you can get through the ADA, but also to create some community health worker specific resources, and also to specifically create a training on diabetes and diabetes related eye disease. And to talk a little bit more about that training, I'm going to pass it over to Mercedes Cruz from Health Bridge for You, who we have brought on to help us develop that training and bring it to all of you very soon. I'll pass it on to you, Mercedes.
Thank you, Aurora. Hi, everybody. How's everybody doing? I am so excited to be the newest contracted, but the newest member of NACHW that has been working tirelessly and excitedly about the new training that we're going to bring. But let me tell you a little bit about Mercedes. So I have been a community health worker certified by the state of Texas, because I'm in the great state of Texas, since 2005. I have been certified as an instructor since 2010, altogether between CHW and CHW instructor. I have provided our great community of Texas more than 1,700 workshops on the 28 certifications that I have, including I am a licensed vision screener, mental health, and I do a lot of heart and stroke and diabetes. Why? Because in 2003, Mercedes got the sad news that she has diabetes. So I'm a person with diabetes living since 2003. I am a stroke survivor. I have been the spokesperson for American Heart since 2005 and worked on a lot of their initiatives. So it was, I think, a win-win situation when NACHW reached out and said, do you want to be part of this initiative? And I'm like, sign me up. What do we need to do? And I have been going to the ADA website. I'm going to tell you, awesome resources. Even if you think you know, you still got to go back and revisit, because we all know that statistical, if we don't utilize something a lot, right? After an hour, we lose 50% of the information. After 6 hours, 75%. So we got to keep on it daily and revisit yourself and retrain. So for this particular curriculum, we will, and Aurora is going to put that information for you guys to have. We will be training in June. The curriculum that we developed, it looks kind of big and kind of dense, but it's really designed as a train the trainer, because I know CHW, we go out there and we educate. So I really wanted to put a lot of good resources and information and a lot of handouts from the ADA as we put together the toolkit, so that you can have as much. You can either, when you teach it, now I'm going to teach it in 2 hours and really help you understand how the curriculum was laid out, and it's all bringing you back to the ADA and a lot of the resources that they have. As a matter of fact, I took that risk assessment that Laura was mentioning, and I was like, oh, I got a 6. I was like, yeah, you're at risk. And I did get that follow-up email, Laura, that said, okay, have you done anything to talk to your doctor? And I said, yeah, I did it. So I answered it, and it was really good. But I'm also registered with the Living with Type 2 newsletter that I just got the one for this month. I got it today, and it's a lot of information about vision, but also about my plate. So imagine all those resources at your fingertips from experts, at people that have done the science behind this, and the training that was created was based on that science. And with a little bit of flair, because I'm Cuban and I'm a little hyper kind of thing, so I threw in a little bit of Mercedes flair into it. And I'm really looking forward to walking that path with you on June 2nd, when we unveil the training and the toolkit. So I want everybody to sign up for it. Like I said, I wouldn't have survived where I am right now if I didn't learn to live, because that's my big time. You need to learn so you can live, because remember, You cannot fight a disease you do not fully understand. So the more you learn, the more you fight, the more you live. And yes, I get these babies checked every year, and I get that dilated eye exam. And to my great blessing, every time I go, she's like, you got no damages. There's no damages to the back of the eye. Your blood pressure, this, your sugar. Now, what gets a little bit tricky about my blood sugar, is the stress, because I have all these projects going. But very excited to be able to bring that training to you guys. So don't forget to sign up for it. So looking forward to seeing all of you for that 2-hour training, and bringing that resource that the ADA has graciously funded to bring to our communities, Texas and all the 50 states, guys. So remember, resources sometimes are hard to come by. We just got to take advantage when it's available. So awesome to be on board. Back to you, Aurora.
Thank you, Mercedes. So just to highlight again for folks, we're going to have our training on June 2nd. This is going to be 3 to 5 p.m. Eastern. I know someone in the chat asked if it's just going to be in English. Our first on June 2nd is going to be in English. Later on, we're going to have it available in English and Spanish. And probably later on in June, we'll do a session just in Spanish. So keep on the lookout for that. We intend to have everyone who comes and attends take a little assessment, and then we'll be able to give folks certificates, which you'll hopefully be able to take back to your, if you have certification, and get CEUs for that time. We're going to hold a raffle for some gift cards. And we're hopefully, we're going to have a lot of fun. Mercedes is going to be leading us in that work. So we're very excited about that. Yes, please sign up. And this is also open and free for all. If you have other community health workers who you want to recommend, please feel free to pass this on. And this is going to be a great training, especially for some of you CHWs who said you were newer in training. This is going to really go over some of the basics of diabetes, of eye health, and it'll be a great sort of intro for you. The other thing I want to share before we get into Q&A is that the ADA has also very graciously given us 200 of their CHW memberships to offer to our CHWs who attend our trainings and our webinars. So in a second, I am going to share that link in a chat. It's a quick form, and then they will set you up with a free membership for a year. This membership includes access to the ADA's COVID-19 resource page, discounts on journals and ADA books, save on registration, participating in continuing education, e-newsletters, webinars, and so much more. You can see all the benefits listed on the screen. So once again, I'm going to drop that in the chat. So it's going to be the first 200 people who sign up. But we're very happy to be able to offer that to some of you on the call today. So once again, thank you guys so much for coming. I'm going to drop those links in the chat. Now I think we'll have some time for a Q&A. Let's see if folks have any questions.
So before we get started with Q&A, I've been in diabetes for over 30 years. I just sort of leave it at that these days. So I've been in diabetes care and education that long. And I think, we've had some successes. It's slowly but surely, we've had some successes. And one of the things I've mentioned earlier is about 30% of individuals with type 2 diabetes don't know they have it. And while that's sad, so to speak, it used to be 50%. So at least, we are progressing, showing you that, we're making a difference. The other thing I think I was in denial on, I said 88 million people have pre-diabetes. No, it's 96 million. So just wanted to clarify that and make sure I got the right number out there. I think it's changing so quickly and rapidly. And I think we do get in denial. I mean, having people with pre-diabetes and diabetes is, I guess you could call it job security, but we want a cure. We want to eradicate the world of diabetes. So we can do this together, little by little, one by one, making a difference in individuals' lives. So yeah, I'm ready for questions. I know Mercedes is ready.
If anyone has questions, feel free to throw them in the chat. And I know people are saying there's a little issue with the form. Let me fix that right away. Sorry about that.
Another thing to note is that the retinal risk test is free. It's free to everyone. So I'd encourage you to go on the website and let me type that in the chat too. So you'll have it. Make sure I get the dots in the right place there. All kinds of resources there. www.diabetes.org/iHealth, all one word. And we are doing a lot of new work to the website. We just published 9 patient handouts that are on different topics, from, why an annual eye exam to floaters in the eyes, that kind of thing. And those are on our website. And then the Spanish versions are just getting translated. So they're coming right behind, and they look really good. We have a lot of good peers at the ADA that have done that work and done a really good job. So they're nice, very nice.
Yes, Laura, I had an opportunity to download them already and look at them, and they're very good. Yes. And I was wondering where the Spanish ones were, because I'm like, I download Spanish and English simultaneously.
Yes.
I'm like, I'm missing my Spanish ones. But so I'm glad to hear that they're coming.
Right. And raise your hand if you're not surprised that Mercedes has already downloaded them, right? She's already downloaded those handouts, and they are really good. I'm glad to get your feedback. Thank you, Mercedes. Is anybody on the call from Tennessee? Anybody from Tennessee? No? Well, I said I was from Kentucky earlier. Mercedes wall reminds me of Tennessee orange.
You know what's funny? It comes, I think this is, so let me tell you, I have screens here. I have screens back there. I have screens here. So I'm set up for virtual training because I had to do that a lot during COVID, like 300 people at a time. So I had to have the technology, but it's actually my entire office. It's red. And the reason being, I always wear red because I represent the American Heart Association, but it's also the ADA color. So I have a win-win no matter how I put it.
I know, it looks red. I mean, it looks
orange, but it's actually red just because of the camera quality. If I go with this 8K, then you will see clear, but I don't want you to see my wrinkles, so I'm using this one right here, or my gray hair. So,
all right. So no questions out there?
I'm looking in the chat. Thank you, Violetta. I see you're saying thank you for the training and information about diabetes. I want to say you're welcome. Thank you for being here. But I'm scanning through the chat. I'm not seeing any questions. I'll give it another minute. Also, if folks want to come off mute and ask their questions that way, you're more than welcome.
Well, while we wait, because I am a person that American Heart always picks me to do the call to action. And this time I'm not going to ask you for money, okay? Because that's when I get up there and I talk about being a stroke survivor. I'm like, call to action, we need funding for this. But again, even for the ADA, remember that there is that part on the way up. But today's call to action is going to be a commitment, right? Where all that are here are going to make a commitment to get what checked. If you haven't gotten your eyes checked yet, and we're in May, remember we got a few more months till the year ends. I always get mine done in December so that I'm consistent, and they always schedule me at that time because I got a little bit more downtime then. But let's make that commitment, all of us together, that this is the year that we will get that eye exam. that if we're a person with diabetes like me, we will get that A1C under control. And again, there's a new thing called time in range. And again, Lara, I'm looking into that and reading already on your website on that. So I can't
Excellent.
wait to get more details on that so I can bring that information also out. But we're going to make that commitment that we are going to be proactive in prevention, right? We're going to take care of business because remember, we got to live. Don't you want to be my friend forever, right? So yes, I know. Look at Tamara. She's like, what's wrong with this crazy lady? Well, I'll tell you what's wrong with me. If you survive strokes, then life it's worth living to its fullest with the joy. And yes, this hand is a little bad and I do have numbness to this side, but that don't stop me from having fun and teaching. Because you know what? I may be slowly, progressively dying in my disease, but I'm going to educate as many people as I can while I'm still here. And that's where you all come in because now I teach you, you teach others, and others teach others. And look, we can empower the entire world to take care of their vision, take care of their diabetes, take care of their heart. We're movers and shakers. That's what CHWs are. We are movers and shakers in our community. But we got to start with doing some stuff for us. Then we can tell them to do it for themselves. Okay. So that's my call to action for everybody here today.
Thank
Mercedes,
you.
I just want to say I love the energy you have. And being that we're talking about diabetes, my blood sugars 21 years ago went over 2,000 and I was in a coma for 2 days. So I am definitely a survivor. And I join you in celebrating life and taking care of self and doing things for self. That's the most important gift we can give to ourselves.
Thank you, Cheryl. I want to lift up that Tamara in the chat had a question. Does anyone have any go-to resources for those who need glasses and exams and who can't afford it or who do not have insurance? Mercedes or Laura or anyone else on the call have any advice?
Actually, this is Odette Brown speaking. I work with the American Diabetes Association. VSP Vision Care actually does have what they call their Eyes of Hope. It is a foundation that supports individuals who may be at high risk for diabetes and vision impairment, but they also serve rural communities, those who are underserved and underinsured. And so you can reach out to them via their website. You can also go to Focus on Diabetes website, and you'll find a section at the bottom of the main page where it refers to find a healthcare professional, and it will also link you to VSP, but it's called VSP Eyes of Hope. And I'll put it in the chat.
Excellent. And Odette is our director of Focus on Diabetes. And she and I work together on the Eye Health Initiative. So she's great.
Thank you, Odette. And I see someone asked this earlier. I am going to send all this information out to you guys in an email to everyone who registered, and I will include these links that I also see folks are dropping in the chat. Thank you to make sure everyone has those.
And I think someone asked about information from today, and I will send that follow-up overview page either this afternoon or tomorrow. So you can get that out.
Hi, this is Davina Fan with the National Eye Institute. I just dropped in the chat a link to our free or low-cost eye care resources. It's just www.nei.nih.gov/low-cost eye care. So we just updated it for Healthy Vision Month this month.
Thank you, Davina.
Well, I want to thank Aurora for helping coordinate all this and working with us. I know on the ADA side, and working with Mercedes to cheer us all on and provide great information. So it's been a pleasure and a privilege speaking with you all today.
Yes, thank you so much to Laura and Mercedes. We really appreciate it. This is sort of just the beginning of our partnership for the rest of the year. We look forward to seeing everyone at our training on June 2nd and some other trainings that we'll do after that, and see the ADA again at our Unity conference on August 3rd and 4th. If there are no more questions, I think we can give folks 5 minutes back to their day. But again, we really appreciate you all and look forward to seeing you soon. Thank you.
Look forward to seeing you on June 2nd.